The echocardiogram belongs to a patient with a systolic murmur. The four-chamber view indicates right ventricular enlargement. In the contrast study, many contrast bubbles appears in left atrium, suggesting an atrial shunt. However, the subcostal view did not confirm the presence of an ASD. An additional off-axis view was performed for more comprehensive evaluation of the interatrial septum, which indicates intact septum. Let's dive into the transesophageal echocardiographic views. The intratrial septum appears intact in this view, although the septum in the middle side is quite thin. The bicaval view also indicates an intact septum, but is this enough to rule out any shunts? The interatrial septum in all regions, especially at the borders of the superior vena cava and inferior vena cava, should be carefully assessed. A large defect is observed here at the junction of SVC with the interatrial septum, specifically at the corner of the septum. It is compatible with Sinus Venosus ASD. The 3D echo from left atrial side shows the interatrial septal defect, and the view from right atrial aspect confirms a Sinus Venosus ASD. Furthermore, it is important to note that nearly all cases of sinus venosus ASD are associated with anomalous pulmonary venous return to the right atrium or SVC. Conclusion: right ventricular enlargement is typically associated with significant pathology. ASD is the most common cause, and the presence of intact interatrial septum on transthoracic echocardiography cannot rule out all types of ASD.